Being that I teach in nursing, one challenge that I experienced over the time of me being an educator was really trying to help the students understand the content and apply it to real life situations. So, being that I just went through AQ, one of the innovative methods that I learned to help students engage was micro lectures. Micro lectures are a great way to help the students get the information that they need, but not having to stand in front of them and read off a slide or PowerPoint and just talk with them, which is, considered passive learning. So I started recording my lectures and posting them to Canvas and having the students to review that information prior to class. So then, with nursing, it's not black and white information. It's very gray, very, critical thinking type information. So I would ask them to review my lectures prior to class. Then in class, we would do more active learning, which is, unfolding case studies and application based learning. So I noticed that the students really loved this way of, class because, they're not spending their class time reading off a slide or listening to someone talk. They're actually spending class applying what they need, applying the information they heard to a real life situation, and then going to clinical and being able to apply the information to a real patient. And so they inform me that they really like the pre-recorded lectures so they can really be in class and actively engage with me as the faculty as well as each other. So that is one of the challenges that I experienced, but I was able to take an innovative method that I learned through AQ to be able to change that challenge and turn it into something wonderful. That way it works for me. I'm not spending my time in class lecturing, but I'm spending my time helping the students to apply the information that they heard in my pre-recorded micro lecture, and helping them to apply it to a real life situation. That way they can begin developing critical thinking and clinical judgment.